So it's the 1st of April, and we are doing something different for Fiesta FM. This is a pre-record, and this is Yaso Brown talking to you today for a very short and special community hour. So we're changing the way that we do things to respect social distancing whilst we are getting through this coronavirus crisis. Now, you're probably very much saturated with news about COVID. It's basically affecting the way that we live and interact. So it's something that we're obviously always aware of. I actually tried for the show to Google non-COVID news and couldn't really find anything. And then I looked at what's trending, and it's all coronavirus related. There was only one news article that was dated the 20th of March, so some time ago, about how it was thought that there was Russian interference with the British general elections, and I couldn't really read past that, but that somehow managed to sort of get buried amongst the COVID-19 news. So it's really interesting. Doctors are quite sought after in the media at the moment, and there's lots of requests to find out what frontline doctors are feeling and seeing and how they're coping. And there's a particular interest in people that have actually come into contact with patients that are COVID positive, particularly those that are unwell. And this interest actually is an international interest. So the most interesting conversation that I've had, and it wasn't for a personal comment, was from an American journalist, and they wanted to find out about just general opinions about the differences between the UK system and the US in terms of the COVID crisis. And really the main thing is that, you know, we are very lucky to have the NHS. There is just no doubt about that. We've got a centralised service that can receive and is to directly receive information from the government and public health and deliver on that, basically. And it should be something that is also clinically led. You don't have the same coordination in the US, and so we're really, really lucky that we have that, and that's helped, even though there's been and there continues to be a lot of discussion about personal protective equipment, so the things that you will wear to try and protect yourself from getting the virus, even though there is so much press still going on about that, and that it's not adequate at the moment for key workers, especially healthcare workers, that actually we at least are able to have some way of organising across the country that distribution, and that logistically would have been so much easier just because of the fact that we've got the NHS, and we've got that cooperation, we've got nice guidance, so everyone is working to the same guidelines, which I don't believe happens to the US. They have something called JAMA, but I don't think they necessarily have to follow that. And, you know, really in terms of competition, we all work together in the NHS. So if there's something that's been found to be really effective, it is then communicated across the system. Whereas, you know, and that really helps health equality. Whereas in America, you just won't get that. You will get, because it's then something that people will pay for, you get that divide and imbalance. Unfortunately now, whether that all changes during this crisis, who knows? But, you know, that's what we've begun with. And, you know, it's exactly why we were able to organise NHS 111. And for that to be really, initially has started and is continuing to be almost the gatekeeper. And as things unfold, obviously primary care will continue to play that part, if not take over. So we are very lucky, and we're not having swathes of people worrying about whether they're going to be able to pay for ventilators. I know it's really horrible and probably causing a lot of anxiety with what you hear in the press increasingly now about that we're expecting to get 1,000 more ventilators next week, and it just presses the point that this is serious and we're expecting people to become critically unwell, but we're preparing for that at the same time. And it does obviously make you worry, but at the same time, no one in the country is going to worry about whether they're going to be able to afford that if they are a UK citizen. So that is something that we should be really, really grateful for. And I think we should just take time to think about that, actually, and really, have some sort of feeling in our heads that we would never want to be in a position where we're also thinking about whether we can afford this. And I think that we are so lucky to have what we have here, which is the NHS. And I think that when we come through this, it is so important that we do always keep that on our minds, and we fight very hard against changes that may compromise what it stands for and what we have benefited from during this crisis from it. So that's me on my soapbox about that. Locally, what's happening, because this is a station that is in Southampton, we must talk about what's happening in Hampshire. The cases of coronavirus in Hampshire have jumped, sadly, from 66 to 498 in just 24 hours. Now, I wouldn't get scared about this. It's a highly contagious virus. We're starting to increase our testing. We are expecting there to be a rise. This is why there is lockdown, because we're trying to delay the number of incidents and control the peak so that we are able to delay it for a time where we have more capacity. So we're expecting a rise, and so we shouldn't be alarmed by the fact that there are more cases. So like I said, there's more testing, and we're expecting this to happen as well in terms of a rise of cases too. Public Health England released figures from this, released this from this morning, showing that the number of cases in Hampshire has risen from 432 to 498 in just 24 hours. So I guess this would be the time where I'd play music, but we're not going to do that today. So what happens, you might be interested to find out how we've negotiated this. So I pre-record, and then what happens is that Felix has got all his gizmos, and he's able to then play the audio that I send him into the radio station, and that's how we're doing it. So it's really interesting times. And we're hoping to do a Q&A, which I'll talk about at the end, and really just see how far we can stretch this. It's been talked about, actually. I just was watching Good Morning Britain today being the 31st of March, and Piers Morgan was saying that, the media have a responsibility to be giving everyone the information that they need in order to, do the most good in terms of social distancing, and understanding exactly what's expected of each and every one of us during this time. And so I guess, it's really good if Fiesta is able to carry on. And I think what's great about Fiesta FM is that all the different presenters, they will be presenting lots of different things, and actually there might be a nice break from COVID. I know that I have, but I guess my background is medical, and it's part of the advocacy work that I'm doing, so I will probably talk about it. But I think the other presenters, at least, will hopefully offer a nice sort of relaxing break from all of it. And it's nice to sort of get to know people locally as well, particularly if you're in Hampshire, and having your ear on the ground about just normal everyday people, sharing something. I think there's a lot of speculation that TV, radio, I don't know, people on Instagram, influencers, they're going to do really well because people are so bored. I'm not sure. I'd be really interested to see what's happening. I think this is going to go on for likely a few months. And I wonder whether all this increased time at home has actually made you feel that actually there's only so much TV you can watch, there's only so much computer screen time you can have, there's only so much superficiality you can take. And actually, whilst it was fine to consume when you get back from work because you're already sort of brain dead at the time and it's just easy, but whilst you're actually at home, remote working, or whatever it is that you're doing, self-isolating, actually, these things don't satisfy anymore. They're not enough. And actually, you start missing probably what is more important, which is, real conversations, real people, your friends, your family, people you actually know. And I feel like that is what people are going through, and I do wonder whether that will resonate with you if you're listening, and that actually these screens, they're not enough anymore, and during this time we want more. We want something real and authentic, and I wonder how much that will impact us. And I think actually exploring the impact of remote working, going onto that, is going to be really, really interesting for the country. I mean, certainly in general practice, there has been a real resistance by some camps of doing remote working, and I just think that the interesting thing with this is we get to see how far we can actually push it, and actually, I wonder how much that will change the way we practice, 6 months on from now, and how much everyone else is receptive to it. So the reason why remote working in, general practice also wouldn't work is not just because of the doctors that might not be comfortable with it, it's also the patients. But actually now, the entire country is expecting for their GP to first speak to them, or for there to be some sort of triage, virtual triage. So there's an expectation now, an understanding and a readiness, and I wonder how much that will change the way healthcare is shaped going forwards. So I've been doing a bit of street outreach in the mornings. So we go out and we look for those that are street homeless currently. And the council is doing so well in trying to house all the people that need to be housed, but for various reasons, it's not something that is going. I don't think it's something that is going to be 100%, okay, because we are dealing with human beings, and free will, and people having the right to choose what they want, and situations not being the right thing for an individual, or the system not working for them, etc. But I mean, it's just being out and about. I guess the reason why I'm mentioning it, as a key worker, you do still notice people sitting on benches, aimlessly being in the streets, and I hope that when I'm next out, I don't see that. And it was pretty early in the morning, so I can only imagine what in the middle of the day is. And I know that for some of you, it's just loneliness, basically, and it's your way of seeing other people. And I don't know how to give you comfort over that, but you've just got to remember that this is for everyone, and actually we've just got to be responsible for each other, and that's the best way to try and look at it. and no one knows which one of us at this time has the virus. It's very contagious. So, just assume that everyone has COVID until proven otherwise, and practice safe social distancing. And if you need to self-isolate, make sure you are self-isolating, and make sure that if you are getting grief from your employers, that you are having responsible conversations and making sure that things are documented so that you are best supported through this. Other news. Is there other news? Well, I think that this is a really difficult time for people that are self-employed. The government has outlined how they are trying to support people through this really difficult time. These measures that the government will make, it will do a lot to help many people. There will naturally be some that it doesn't help enough. And my heart really does go out for those of you that are struggling financially. It must just be one of the worst things to go through. And then on top of that, potentially feeling very, very isolated. So just understand that this is something that lots of different people will be probably going through. And I think the best thing is probably to find out if there are helplines that you can call. I will try to look into this for the weekend, just so that there are people that I can signpost you to that you can speak to during this time. I guess I probably thought about it a bit more because I do a lot of wildlife photography, and obviously that's completely changed now. I can't really, it has to be sort of essential travel, and the places that I like to go to, yes, I could probably justify exercise, but I can absolutely do my exercise where I am at home. So, actually everything's changed now, and it will have to be garden photography, which is actually really good because I think I would have completely overlooked my garden birds and the other wildlife that's there, and I can now really focus on that and just appreciate what I have. And not everyone has a garden, which I'm really well aware of. So it's something that I'm definitely grateful for, and at least I can shine a light on that for myself, I guess, in years to come, and just remember some good things that were there, which is just to focus your attention on what's in front of you. And I don't think that I possibly do that enough. But if you're a professional photographer, so someone that makes more than 50% of your living off photography, that's going to be tuition and tours, and as well as the body of work that you create through being out in the field. And the difficult thing about this sort of time of year is that this is when you're seeing courting behaviours or sparring, or eventually the next generation, and that's it's a really interesting period of behaviour at the moment that you can go out and see. And so it's very difficult for all of that to not be accessible, but the best of them will adapt. It's just a really difficult time. I guess that's an example of people that are self-employed that are really probably struggling at the moment. So certainly it's not easy times, and it's a big adjustment for so many people in so many different ways. I think it's just understanding that, and I think that perspective, and I guess that in some ways makes you feel like it's a collaborative sacrifice. We're in this together, and we will also see each other through as best as we can. And I guess if you're sort of not understanding that, just think of the community apps or the WhatsApp groups that are springing up everywhere, and people just trying to reach out in the way that they can, not only just to protect the vulnerable, but just to support each other. There are even neighbourhood WhatsApp groups, for example, that never would have happened. A street WhatsApp group, I think that it would ever have happened. Unless you're in a bizarre situation, an unprecedented situation like this. So just try and keep your eye out for things that would probably never have happened, but actually are positive from this, and that might be something that needs to keep you going for a bit. So I think that's me spieling on for long enough, really, non-stop. I'm looking at the time and it's 20 minutes, my gosh.